And from our COVID-19 commander, Jerome. So there are 49 active cases of coronavirus in Victoria. Yesterday we recorded 5 new locally acquired cases. 2 were previously identified primary close contacts and have been quarantining throughout their infectious period. 1 is linked to an exposure site, and investigations are still underway to confirm the nature of the 2 remaining transmissions. One of these cases is a staff member at Arcare Maidstone, an aged care facility, and Jerome will speak to that further in a minute or so. But I do want to thank the worker for doing the right thing and getting tested immediately upon getting symptoms, helping to keep the facility as safe as possible in the circumstances. That is exactly what we want to see. We had 45,301 tests and 17,702 vaccine doses yesterday, both fantastic numbers, and I want to thank all Victorians for coming out and for their patience in getting tested and getting vaccinated. There are further exposure sites linked to other positive cases that have been published online, including a number of Tier 1 sites, and again, Jerome will take you through those shortly. We are now managing more than 4,000 primary close contacts across all of our exposure sites, and encouragingly, we've now received testing results from the majority of these. 70% of our primary close contacts identified as of yesterday have returned a negative result. But it's true to say that this remains a day-by-day proposition. Our public health team are working so hard and so fast to get ahead of this outbreak. Our contact tracers are chasing down every single lead. Our incredible nurses and pathology staff are testing thousands and thousands of Victorians, and all Victorians and all Victorian businesses are again rising up to the challenge of this latest outbreak. So that does mean for Victorian businesses keeping their doors shut to keep all Victorians safe, and I want to thank them. I also want to acknowledge, as I have a number of times over the last week, this is particularly devastating for Victorian businesses, and we are aware of that. And that is why we committed to deliver a business support package to help them get through this very difficult time during our 7-day circuit breaker. So today we are announcing a $250 million business support package for small and medium-sized businesses, including sole traders. This is a bigger and broader package than the one that we delivered through the lockdown, the circuit breaker lockdown back in February. And it's made up of a few elements: $190 million for the Business Cost Assistance Program. These are for grants of $2,500, and we expect around 76,000 businesses will be eligible for this support. As we said, this is a bigger and broader package of support than the one in February. There's $40 million for the Licensed Hospitality Venue Fund. This will provide $3,500 grants, and we estimate around 11,600 venues will be eligible for this fund. And finally, there's a $20 million events support fund, and this is to provide support to event organisers who have had to cancel events during this circuit breaker period. We're working with the industry in exactly the eligibility criteria of that fund. We wanted to make it clear today that as part of this $250 million support package, we will support the events industry. So this is $250 million of practical, tangible financial assistance. It's what we committed to do, and I want to thank the Treasurer for putting this package together. This supports businesses who have been hardest hit by the circuit breaker lockdown. At the same time though, Victorian workers need support, and that's where we needed Canberra to come to the table. And I'm very sorry to say that they have refused to do that. We asked multiple times of the federal government to support workers during this period, and the unrelenting answer has been no. Victorian workers deserve more from the federal government, and I am beyond disappointed that the answer from the Prime Minister and from the Treasurer has been no. to talk in further detail about the package and indeed the engagement that we have had. I've spoken to the Prime Minister, the Treasurer spoke to the Federal Treasurer on a number of occasions, but to speak to this package and our advocacy for all Victorian workers, I'll hand over now to the Treasurer, and then after Tim, we'll hear from Jerome.
Thanks, Acting Premier, and I suppose I'd start off by saying that the Acting Premier is much more reserved in his language than I will be around the federal government's position on this. It is totally unsustainable. Essentially what the Commonwealth are saying, apart from all the rallying cries we hear, apart from all the speeches of encouragement and support, workers need tangible support from the Commonwealth, just as they're getting from this government. $250 million of assistance is going direct to business. Interestingly, the Andrews Labor government is putting $250 million, the biggest single pro rata allocation of any support fund this government or any other government has put in place. Now, you'll hear a lot from the federal government about the need for us to work in partnership. Well, they're not a silent partner. They like making speeches. I'll tell you what they're not. They're not a tangible partner. We need them to step up to the plate. Workers need them. The community needs them. Treasury anticipate that the economic cost of this event will be about $700 million. This government, 1/7 of the Victorian economy, is contributing $250 million to assist businesses see their way through. What we needed was the Commonwealth to make at least a comparable offer of support to working people. Now remember, only yesterday we heard representatives of the federal government saying that they were the party for the workers. Well, nice words. It would be really good if the self-styled party of the workers actually did some work for working people and provided them with the assistance that they need, indeed that they require. I am angry and I'm disappointed. I'm disappointed because whilst all the language talks about a partnership, it delivers nothing in real terms for the people who need it most. They like to pride themselves on being the party of the forgotten people. Well, the people they seem to have forgotten is Victorians, and in particular Victorian workers. So far as this government is concerned, each and every day that we've had to deal with the trepidations of the pandemic, we've been able to count on the support of the Victorian people. Single-handedly and with focus and dedication, they've devoted themselves to keeping the nation safe. They've devoted themselves to an effort that is essentially not of their making, not something that they have encouraged in terms of wanting to go back into these sort of enormous privations, but they've done it willingly for the nation. And indeed, if this pandemic were to seep out of this state, as it did out of a South Australian hotel, well, of course, the cost to the nation would be incalculable. We need to get on and deliver the things that we should be doing in partnership. And the first and most important thing I say the Commonwealth should be doing is putting the interests of people first. Certainly from our perspective, this package is quite profound. $250.7 million to support small and medium businesses. This is a broader package in terms of its scope. It will also include sole traders who've been impacted by the circuit breaker action. $190 million will go to a business cost assistance program, providing $2,500 grants to small and medium businesses. Some 76,000 businesses will receive this support with payrolls up to $10 million. Basically, the test will be, have they been able to operate during the circuit breaker, or alternatively, have they been able to operate online. So if the business is closed, if they haven't been able to provide an online service, they will be eligible for these entitlements. There's $40.7 million for the Licensed Hospitality Venue Fund, $3,500 to support up to 11,600 businesses, restaurants, pubs, hospitality venues, helping them with paying rent and wages, and of course replenishing perishable stock. And as the Acting Premier indicated, $20 million will go to an events support fund to assist those targeted businesses who've seen events cancelled during the circuit breaker restrictions, and they've been doing it tough. So certainly from our perspective, the biggest single package on a pro rata basis that this state or any state has provided. I might also make the point that the test and isolate payments that we make are now coming in at $2 million a day, and this is a contribution, a payment that the government is proud to make, because we're proud of the effort that Victorians are making during this very difficult time. What I would like to have is a real partnership with the Commonwealth. 4 to 5 times over the last 3 or 4 days, I've had conversations with the Federal Treasurer urging them to make some contribution. Even got to the point where I said, even make it a piecemeal one so that we can pretend that you're doing something tangible when in your intent and in your efforts you're not. But the Commonwealth's view is that if these are short-term circuit breakers, then the states should pay for them. Well, we're paying very substantially, and I don't think that working people should be paying. If you think about the additional contribution that the state of Victoria has made in the November budget, and of course in the recent May budget, you will find about $75 billion of increased effort. That increased effort has kept Victorians safe, it's fired our economy, but ultimately our success will be defined by how we work together and how we deal with the challenges that confront us. And really, it's about time the Commonwealth stopped with the words, stopped with the empty gestures, the rallying speeches with nothing behind them. This idea that we're working hand in glove when they never put their hand in their pocket is nothing short of a disgrace.
All right, good morning. Just a quick update on where we are on the management of the overall response, and then the Acting Premier, Treasurer, and I'll be pleased to take any questions. As the Acting Premier said, we do have an active case now in aged care. At this point in time, we do not have an acquisition course for that case, so this is of an utmost priority for us to do as much work around this as we can over the coming hours. I can confirm, and I'm really pleased to confirm, that the case involved, the staff member involved, presented immediately for testing as soon as she had symptoms on Friday. That is so important. We have identified her infectious periods potentially being Wednesday and Thursday of this week, the 26th and 27th of May, and of course we're now putting in place our full response, working very closely not only with our colleagues in the Commonwealth, but particularly our local public health teams in Western Health. We know, of course, that families who will have residents in this particular aged care facility will be particularly concerned. We'll be working very closely with them. And my understanding is that our care, who operates this particular aged care facility, has already been in contact with the families to address them, to set out what steps they'll be taking. We learned about this positive case late last night. Within the hour, we had the operational command team set up and running across a whole number of agencies to establish the situation, to put controls in place within that particular aged care facility, and to surge the additional testing work that we're doing right now. This particular aged care facility has gone into further lockdown. Residents have been confined to their rooms and isolated immediately. Staff have upgraded now to Tier 3 PPE. Staff coaching, of course, was already in place. That again has been stepped up. And my thanks to all the staff who are at this site doing the really important work to establish where else this virus may have circulated in that particular facility. We are doing on-site testing there, of course, this morning, today, during the course of the day for both staff and residents. It'll be particularly priority for us to identify any potential exposures that the staff member has had within the facility, and of course any exposures the staff member may have had in the wider community. I can confirm that this facility has been on the Commonwealth programme for vaccination. Over half of the residents have been vaccinated. We believe about a third of the staff have been vaccinated. This individual positive case member has had one vaccination, has had her first vaccination dose. Again, we've got really strong records with this particular facility, and my thanks to them for them. But I would please encourage anybody who has got any connections with our care in Maidstone on Wednesday the 26th of May and Thursday the 27th of May, please get in touch immediately, isolate and get tested. Yesterday we updated on the other lines of inquiry that we're continuing with, and I'll provide a brief update on those again now. As the Acting Premier has said, we now have over 4,000 primary close contacts across the City of Whittlesea outbreak and the Port of Melbourne outbreak. Over 3,000 of those 4,000 people have already returned a negative test result. That's a significant step up from yesterday. Again, it's encouraging to see people coming forward to get tested and to see those negative results coming in against the primary close contacts. We are, of course, continuing to work with those remaining people to get their negative results in. All those 4,000 primary close contacts will continue to isolate for their 14-day period. On Friday, earlier this week, we talked about the 5 higher risk social venues, the bars and clubs that we were focusing on. Again, we've had a really good response now. Well over 500 people have come forward. We've identified over 500 primary close contacts. We're seeing a lot more of those negative test results now coming in. So 57% of the people who attended those pubs and clubs have now returned a negative test result. We're working with the remainder to get their test results in as well, but we have no further cases at this point in time, or no further evidence of transmission at those locations at this point in time. Yesterday we also talked about the individual who works for a large food distribution company, a wholesale food distribution company, with a large number of visits across the northern suburbs and Dandenong area. We're pleased to confirm that at least his immediate contacts within the workplace, the depot where he works down in Carrum, 8 out of 9 of those work colleagues have confirmed negative test results. We're awaiting one more test result. We're doing a lot of work with about 20 or so retail premises that this individual visited. Again, my thanks to all those retail premises. I know it's challenging to be asked to close at short notice, to do the deep cleans and to get all the staff tested and isolate for 14 days. My thanks to their huge collaboration for doing so, and we'll continue to work with them over the coming days to establish whether there's been any other transmission at those locations. Again, please, I would ask anybody listening to this or through our colleagues in the media, if you've been to those exposure sites, they are a really important line of inquiry for us. We're really keen to establish anybody else who's been to those premises. We'd like you to get tested and to isolate until we see a negative result come through. Yesterday we also sent around 500,000 text messages, SMS messages to people in these suburbs to advise them of our concerns around some of those exposure sites and encouraging them to test those sites. And again, I think that partly drives that 45,000 testing results number. That's the 4th consecutive day of more than 40,000 test results a day. Really encouraging and strong results. My thanks to all those people for coming out and getting tested, and it really helps us to identify where else we're getting to with this virus. The third line of inquiry has been around a positive case we identified yesterday at Mount Ridley College. We have now 700 staff and students who've been asked to isolate and get tested as either Tier 1 or Tier 2 close contacts. We have set up an additional dedicated testing facility for them at our large-scale testing site at the showgrounds. They have dedicated lanes to enable them to come and get tested today, to do that as swiftly as possible so we can identify if we have any other areas of concern at that location. And finally, we've been looking at the positive case we identified yesterday at the display home in Mickleham. We now have 30 primary close contacts identified with that individual. They're all isolating and getting tested, and we're pleased to see the progress we're making on that front. In terms of the new cases today, obviously I've talked at length about the most important of our cases today, the mystery case in the aged care facility, and that will be a real focus for us, of course, in the hours ahead. Of the other 4 positive cases in the community identified today, 2 of those are linked to the Port of Melbourne workplace outbreak. They were already isolating, they were already primary close contacts. We are pleased to see that they are continuing to isolate. And of course this shows the importance of that rapid test and trace program we have in place. Because they're primary close contacts, they'll continue to isolate. We will continue to support them as they go along. On the City of Whittlesea outbreak, we have also two more positive cases. One of those was a customer at the Telstra store in South Melbourne that was already an exposure site. They were already an identified primary close contact, and again, they are isolating. The fourth of our, and this case, the Telstra case, we have identified a new exposure site for them at the Chadstone Shopping Centre on the 26th of May, so on Wednesday the 26th of May between 11:30 and 2 o'clock. In particular, the Yokozuna restaurant at Chadstone. If you are there on Wednesday the 26th of May, we would like you to go and get tested, to isolate, and to let us know, please, that you've done so. There is one more positive case identified with the City of Whittlesea. We are continuing those interviews. He came through very late last night. We have a number of crossover links in some of those grocery and food stores, so we will continue to identify any other exposure sites that individual may have. Finally, in terms of testing, not only 45,000 test results, but 98.9% of those reporting results within the next day, 82% within 24 hours. Again, my thanks to all those teams at the testing sites, in the pathology labs, in our vaccination clinics, and all across the state who are doing such phenomenal work. We continue to operate 210 testing facilities across the state. We've grown those by 21 over the last few days. Many of them are running extended hours and will continue to do so. I would also please just ask you to recognise the waiting times are starting to reduce across the networks as the numbers are coming down ever so slightly from the highs we've seen over recent days. Wait times yesterday were around 60 to 80 minutes on average. Again, please, if you're going to get tested today, check the website. You'll get a good indication of waiting times and you'll find the most convenient testing station near you. And then finally, I think from the point of view of testing and going back to our aged care outbreak, I would encourage any staff across Victoria, if you are working in the aged care sector, if you're a staff member of the aged care sector, there is a whole routine of regular testing in some of those facilities, but if you've not been tested in the last few days, I would please encourage you to go and get tested, regardless of whether you have symptoms. Aged care, as we saw last year, is an incredibly challenging and important space. My thanks to everybody who's working in the aged care sector for the improvements they've made in the last year to really strengthen those infection prevention controls and all the systems that have been put in place. But I would encourage any staff member working in aged care, if you've not been tested over the last few days, I would encourage you to go out and get tested today or tomorrow, so we can be absolutely confident we don't have any further spreading out of this particular virus in that most important of our settings. With that, the Acting Premier, Treasurer and I will be pleased to take any questions. There is no statutory requirement for these workers to be vaccinated before they work. We have, of course, have a requirement within the hotel quarantine system operated by the state, whereby any staff member in that sector has to be vaccinated, and they, of course, have a 100% vaccination record. We have certainly in the public sector, residential aged care sector, we have around 1,800 or we have around 5,300 residents in the sector, 180 units. All of those premises were part of our vaccination programme back in March and April, so all those premises have had vaccination activity taking place and very high levels of uptake amongst the staff. All aged care work staff have been able to get access to vaccination from March, April. We continue to encourage them to come forward and get vaccinated.
But as a prominent public health expert, do you think it could be a requirement that people vaccinated if you're an aged care?
Yeah, so look, my job is not, I'm afraid, a prominent public health expert. I'm here to operate the testing and the contact tracing and the response operation. So that'd be a question for my public health colleagues.
Do you know why the work wasn't fully vaccinated yet?
So look, the public sector, the private residential aged care sector are part of the Commonwealth vaccination programme. I know they've been going around the many private sector residential aged care facilities to offer vaccination. My understanding is at this particular site, half the residents were vaccinated and around a third of the staff were vaccinated. Obviously, we would encourage, as we always have done, any aged care staff to come up and take up the options of vaccination in either the Commonwealth or the state system. I don't, I'm afraid. I can come back to you on that.
Do you know which proportion of the, you said so half the residents have had a vaccine, how many have had both?
Yeah, again, so not part of our vaccination programme. So what I can confirm is certainly within the public sector that we've run, all of those residents who were vaccinated with the first dose back in March and April, if they were on the Pfizer programme, will have had their second dose. Obviously, those on the AstraZeneca programme will get their second dose at the right time.
But you don't know.
I don't have the details on that site now.
How concerned are you that you haven't identified an acquisition case for this aged care?
So look, I think this aged care positive case is of extreme concern to us. We for two reasons. One is it's our most vulnerable and sensitive setting. that we have, and that is why we have such an important response into this since late last night. I am concerned that we don't have at this point in time, an acquisition source. Our fantastic team at the Western Health Public Health team are working very hard to identify that acquisition source. We will, of course, be doing our genomics testing, so we will run that to ground. But at this point in time, this is the biggest priority for us to make sure we fully understand and wrap ourselves around both where the cases come from and any other links that they may have had. Look, I mean, that's a question for a little bit later in the day. I think at this point in time, this is the first mystery case we've seen in this particular outbreak. We now have a total of 4 positive cases in the community that we've identified. This one case is currently not linked. That, of course, is a significant concern for us, and we've got everybody focused on trying to identify where that's come from and any other exposure that she may have had.
Does this woman work at any other?
Sorry? Look, that's not a question for me. That's a question for the Chief Health Officer. As we said at the beginning, this is a 7-day lockdown. We have a lot of work to do. We are now in day 3, where continues to be really important work for us to do to run down these leads. I think what is encouraging is that the leads that we have seen emerge over the last 3 or 4 days are all being run to ground quickly, but we're continuing to see new exposures opening up every single day, and that, of course, remains a matter of concern. At this point in time, I'm confident that we're on a good trajectory with those lines of inquiry we were looking at yesterday. We have a significant amount of work now underway, particularly in the aged care space. We're being supported by a number of other agencies, and we'll be very keen to understand how that's going to develop over the hours ahead. Look, it's too early to say at this point in time. We are testing everybody else within that facility today. We should have some results on that tomorrow morning. That will tell us an awful lot about what other exposure's been there. What I would really like to stress again, this particular individual, she first displayed mild symptoms on Friday. She went and got tested immediately. So we are so grateful to her for doing the right thing. This is what we need all of us to do. We are now in a world where we're seeing small instances of COVID circulating in our community. It's so important that anybody who's got the symptoms, no matter how slight, gets out and gets tested immediately.
Was this woman working?
Sorry, yeah. Yes, so the aged care facility is in Maidstone, and this individual lives in Altona.
Was this woman working directly with patients in this aged care facility, or was she part of the kitchen team? What was her role?
No. So this individual was a healthcare provider within the aged care facility.
Had she worked at any other aged care facilities, or just the one?
So at this point in time, and again, the interview started with the individual fairly late last night. My understanding is she's only worked at this facility at this point in time. Obviously, those investigations are going on, and everybody is being very collaborative in this process.
And how many close contacts does she have?
We are working through that at the moment.
How many people all up at that center?
Sorry?
How many people all up at that?
So we have around 110 staff registered at that facility at the moment. I'll come back to you on the number for residents.
Is it likely to work voluntarily?
Sorry.
Is it likely to work voluntarily?
So the way we identify when somebody comes forward for testing and tests positive, we always focus on when they first started displaying symptoms. In this case, the 28th of the Friday. We then take 2 days prior to that. That's the experience has shown us. That's the key infectious period. So our assumption at this point is that she was infective on the 26th and 27th, both days of which she worked. Yeah. Yeah. So look, I think all I can say to that is we've seen 1.1 million doses now of vaccine delivered in Victoria across the GP network, across the state clinics, and including the Commonwealth programme within the residential aged care sector. Yesterday we saw 17,000 plus delivered within the state clinics. We've got 460,000 vaccines now delivered by the state clinics since the start of the programme. I'm afraid questions around the rollout of vaccination within the residential aged care facilities. There is a bespoke Commonwealth contractor focusing on that, and you'll have to refer questions to them on that. Look, I mean, again, I'm not cited. The state doesn't have the details of the vaccination program within those private residential aged care facilities. Look, we've always said at the outset we wanted to ensure that those most vulnerable Victorians were vaccinated as quickly as possible, and I think that's also been part of the Commonwealth's national program. That's why we did all of our public sector residential aged care facilities in March and April. Obviously, we need to continue to refresh those vaccinations as new residents come into the system. So we're very focused on doing all we can to protect those residents. It's a big job, but it's the most important group for us to protect.
If the online vaccination booking system was working successfully in its test phase was yesterday and taking bookings, why do we have to wait another few weeks for it to be rolled out?
So as I said, Lundy, yesterday, I mean, we are working on the online booking portal. The constraint on getting people vaccinated today is not the availability of the online booking portal. The constraint is we have around 20,000 or so doses rate that we can sustain based on the availability of vaccine that we have at this point in time. That is a bigger number than we've ever done before. We are doubling the rate of vaccination that we were doing even a few days ago. We will aim to continue to sustain this rate until we have more vaccine available to provide. If there's more vaccine available to provide on a sustainable basis, then we'll do what we can to lift up and vaccinate more people. I appreciate for people trying to get through to a call centre that may seem a little bit low tech and it's frustrating if you're trying to get through, but thousands of people are getting through because we have literally hundreds of people working in the call centre taking those bookings and booking people in for their vaccinations. 17,000 plus got done yesterday. We will have another full and busy day of vaccinations today. Walk-ups are being taken at a number of our centres. Details on our website. Waiting times on our website. And just one note on that. Yesterday I was at Jeff Shed in the afternoon. Actually, we saw a significant reduction in the queues yesterday afternoon. Actually, we had periods of time where we were a little bit quiet. That was a nice relief for the staff. But frankly, I would encourage people, do keep an eye on those queues during the course of the day. We are starting to see a little bit of easing off during the back of the day, so that may be a good time to get vaccinated. We're operating some extended hours, and we'd like to make sure we use as much capacity as we have and as much vaccine as we have to get it into the arms of the people who need it.
And can I just ask, just stopping
Sorry. Yeah.
Just following on from Samara's question, so do we know how many federal and state-run aged care homes have residents who are yet to receive their vaccination?
No, so we have no visibility on progress within the private residential aged care sector. We've got full visibility of what's happening within the public sector residential aged care facilities. They're largely attached to our health services. As I said, all of those, I think 180 facilities were visited during the course of March and April for their first vaccine doses. All residents at that time would have been offered a vaccine dose. We had about a take-up of 85 to 90%. Some residents or their delegated decision maker didn't want to take up that option, and that's perfectly okay. And again, staff in that sector have had opportunity to get vaccinated from March, April onwards.
Can you explain the delays that are coming through between when a venue is highlighted as an exposure site and when it appears on the department website? It's been left to a number of venues to self-nominate as exposure sites, and potentially in that time there are people who could have been exposed, essentially walking around the community.
Yeah, look, I haven't checked all the numbers before I stood up here. We've got getting on for 200 exposure sites now being set up on our website. We always, as we've done all the way through these outbreaks over the last 8 or 9 months, we absolutely encourage venues to use every means possible to get the word out if we've identified them as an exposure site. Those conversations start on a 24/7 basis. We're talking to people late at night, early in the morning, every point throughout the day. We go through a process of checking to make sure that we have the details right of an individual exposure site. We go through a process of also assessing and evaluating whether it's a tier 1 exposure site or a tier 2 exposure site. We want to give people as both early information but also accurate information as we possibly can. There have absolutely been examples, and I'm actually hugely grateful for it, where individual venues have been approached and said, we think a positive case visited you, and they're straight on their social media channels, they're straight on their website, and they're straight to talking to their customers. That is a fantastic thing to do. Please keep doing that, because incredibly, people who use a DHS website don't also, are maybe a different cohort than are using the social media feeds for a whole number of venues. So the more the information gets out, the better it is. There will always be occasions where either we've put up sites before the individual knows about it, and we've had examples where we've listed a site because we're concerned. If we haven't been able to get hold of either the right owner or the right manager, I apologise, we want to get the information out there. We've had examples where it's the other way around. That's the way it operates, and when you're dealing with an outbreak that's moving as quickly as this one, we're pretty comfortable that as long as the information's out there, that's what matters.
But you make a very valid point. You have two very separate cohorts of people. One who will be following, say,
Yep.
a social media
Yep.
of a restaurant, and the other who may be following closely the
That's right.
government's website. How do you explain, if you've had time to notify a venue themselves, that the government hasn't had time to update its own website with that same information?
Because what we're doing within our public health teams is we're continuing to sift and prioritise and also assess where those sites are, which ones need to go up, which ones need to come down, which ones can come off. There are absolutely, and we go through, we do the due diligence checks we want to do to ensure we're putting accurate information out there. We've had previous examples, which we've not seen in this outbreak, where people have been concerned about changes of name or changes of ownership of venues, or the address details being somewhat confusing. So we do our best to validate those checks out. That all takes time. We are dealing with multiple cases. We're dealing with multiple venues. So I think, from time to time there may well be a delay by 1 or 2 hours to get them out there. I don't think that's a problem. For me, what's important is that every single day we're getting exposure sites out there. We're getting primary close contacts now. And look, we've got over 4,000 primary close contacts. That's 1,000 more than yesterday. All of those people are being contacted, all those people are being supported, and we need to ensure that they're in the right place and isolating away from the rest of the community.
Just on that, how concerning is it that incorrect times have been listed on those exposure sites?
Well, I'm not aware that any are.
Polls to one of the last night was?
Yeah. Which one? Which website was it? Was it inaccurate?
With the Department of Health.
Well, so I mean, I'm not citing that particular case. Again, we've certainly had examples where we go from the information that the case tells us. That's the information we post. Absolutely, when we talk to the case, bear in mind, when somebody is positive, we're talking to them repeated times. We're talking to them practically on a daily basis to get information. People's recollections change. People's the information they want to provide us changes. We have other information. We check it back with them. Things move around. That will always happen.
So is that corroborated? Is that information corroborated?
Yeah, look. Look, and it depends on each case is a little bit different. So if we're dealing with as we talked about yesterday, we have a number of really important positive cases in this cohort of 50. Some we are more worried about than others. We have cases who we know who've been demonstrated to be more infectious than others. Some are working in more sensitive settings. They will always get more attention and a little bit more support to understand what's going on. And if we're not convinced that the narrative makes sense, or if we're concerned that the information is inaccurate, we'll do what we can to use CCTV, to use travel information, phone information, whatever else was available to us to validate those options. That doesn't apply to every single positive case. 3 of the cases we've seen today are existing primary close contacts of another case. We understand where they're at. We know they need to isolate. We are talking to them again and saying, is there anything else you want to tell us you haven't told us before in the previous days? But the level of investigation and forensic work will be judged based on the importance of the case and how ultimately how much risk we think they pose.
Tim, can I just ask, what exactly did you ask Josh Frydenberg in terms of support of workers who've been laid off? And I guess, what are the options for people now who are staring down rent payments this week without?
Well, I'd advise people not to take the advice that Dan Tehan was offering this morning, which was to go into Centrelink, given that there is no provision for lockdown support out of from the Commonwealth. What we put to the Commonwealth was, firstly, they should put in a targeted and specific payment for workers who basically been affected, stood down as a consequence of the lockdown arrangements for the week. And that was essentially because JobKeeper's off. And the Commonwealth were pretty clear that they weren't interested in doing that. They say lockdowns, state-based short-term lockdowns, are not something that they see a role for themselves in, like pretty much well everything else. The second response, the second proposition we put to the Commonwealth was, well, if we put in $250 million, will you match us dollar for dollar in terms of assistance that can therefore be provided through employers to their workers? Again, the answer was no. The one thing that the Commonwealth have done is that they've agreed not to tax the payments that we give to business, and they did that for the first 2 business support funds, but they've subsequently amended their behaviour. So, look, I am angry and I'm disappointed, but really the point I'm trying to say effectively to the Commonwealth is all the hand-wringing in the world, all the for empathy means nothing unless your words are matched by tangible support. Well, there are limited options. What we are saying in the context of the support that we're giving to business is we expect every business to indicate when they make an application for support that they will deal with their employees. Now, of course, full-time employees will have access to accumulated entitlements if they're not working. However, casual employees will be in a much more necessitous situation. We do have food aid arrangements in place, and as I say, we're already paying out specific payments for those who have to test and isolate. But this is a gap, effectively, in the provision of support to the community, and one which, quite frankly, the federal government should have stepped up to. They have a responsibility for welfare payments. They have an income tax system, so they know who the individuals are, and they could deal with them in an efficient, cost-efficient way. And that's why I'm disappointed, because all the language about partnerships doesn't mean much if you don't back it up when the call comes out.
So what are workers?
Just one more, Simone. Well, Well, it took a couple of days to decide exactly how we'd spend $250 million, yes, and I imagine people would probably want to be satisfied that the government were making decisions in a targeted and efficient way, and that's exactly what this package seeks to do. It also looks at those areas of disadvantage where we have a direct relationship with many of these employers, of course, through the payroll tax system and through the previous grant allocations, but we have broadened this arrangement both in terms of industries affected and also in terms of the inclusion of sole traders. Well, this will be the the first support package where payments will be available during the course of a lockdown, and this is during a week identified lockdown. So we are moving very quickly, but we have to move prudently as well to make sure that we're not seeing this money go to the wrong place, or indeed that we are acting on the recommendations of the Ombudsman that made it clear that we had to ensure that we offered these arrangements in a clear, consistent and accountable way. So we've taken all that advice on board and we're doing exactly that. But I think it's, perhaps if I could just identify my indignation about the fact that the criticisms are directed at a government that's putting more money into support for business and the community in a pro rata sense than we've ever done before, in contradistinction to a federal government who give a good speech and a good rallying cry and doing nothing to deal with their responsibilities for workers. Sorry. Oh, it's not true to say that they've never done anything. They're just not doing anything now. And believe me, it's great that they put in billions of dollars into JobKeeper, but that was a historical contribution, and the challenge that Victorians confront is here and now, and the pain that particularly the workforce will be feeling is very real, and it's here and now, and the Commonwealth should be making a contribution. We can all recant our historical contributions. As I say, we've put in $75 billion of support to grow the Victorian economy and to get people into jobs. That's why we're the standout economy in the nation, despite all the trepidations we've been through. That's why 50% of all the jobs created in the nation have been created in Victoria since September. And that's why, effectively, we're running twice the speed of the national economy, because we've made the right interventions and support. All I'm saying, for the Commonwealth, you did the right thing with JobKeeper, and we supported and applauded you for it. But don't turn your back on the Victorian people in their hour of need.
And Treasurer, you were speaking before about how much you think this will cost the Victorian economy. You say
$700 million.
That's well short of the estimates by Small Business Australia. They say around about $1 billion. How have you worked that out together?
Well, Treasury have put the number together. They also did an assessment on the Valentine's Day lockdown, which they put at about $500 million. The difference in the methodologies between the two is some models don't pick up the fact that a lot of economic opportunity is just deferred, not lost. And the Treasury model picks up both the long-term effect of both deferred and lost economic opportunity, and they balance it out. So $700 million is where we think it'll land, but that's a very substantial number, and it's hurting business, it's hurting the workforce, and quite frankly, we understand that. We understand that we have an obligation to assist and support them. That's exactly what we're doing. We're just looking for all those protestations of partnership to be translated into something real for the people who are hurting most, and that's Victorians. Sorry. Right, so with regard to BCAP, the Business Cost Assistance Program, we will essentially be looking to enable people to make expressions of interest applications straight away. They will then receive an email from the Department of Jobs Precincts and Regions, essentially identifying that they've applied, and when the program is available, they'll be given the details of what that program looks like and how they can apply. With regard to the licensed hospitality payments, we have a system where probably from early next week we would anticipate they will receive an email, because they're licensed with the Liquor Gaming Casino Regulator. They will receive advice and be invited to apply, largely because there's high turnover in this industry. The last time they got payments was September 2020, so we're going to go through a process of just making sure that they're continuing to operate, and that they are seeking the support and assistance that we're proposing.
Sorry, but will they see that cash this financial year? When will practically the first cheque be sent out?
Well, look, we would expect payments to be made progressively. We would hope that by the end of this week, payments will start to flow, and certainly within 2 weeks we'd like to see a majority of those payments, but of course it's dependent upon the timing of the applications coming through. Obviously, as a Treasurer, I'm very keen to see that this money gets out the door, because it goes to a good purpose. It actually gets economic activity going, and I'd like to see it out the door this financial year.
If this lockdown extends, are you looking at extending this support package? Or is there going to be more money available for these businesses?
Well, look, we just have to monitor the situation. I'm not at a point where I can make an announcement about what if and what will we do if something happens. But look, the point I'd make is that every step of the way, every time the Victorian people have stepped up to the plate to help us do our job, we've tried our best to help them. And we will be there when the Victorian people need us.
What are your thoughts on whether you personally think this lockdown will be extended? Do you think the fact that the economy is moving that
No, I think it's simply a function of the fact that there is uncertainty, and this is an insidious virus. There is no certainty around timeframes, but on the best medical advice. The Chief Health Officer has advised us that a 7-day lockdown is required, and we're only 3 days into it. Let's see how we go, but obviously we've got a challenge.
Oh, sorry.
Oh, a substantial amount of it. Gosh. Well, look, I think I do have the numbers for it, Samaya. Why don't I let the Acting Premier talk and I'll come back to that.
Acting Premier, how did you feel to hear the Deputy Prime Minister this morning saying that the vaccination rollout is not a race?
That was said again today. There you go. Look, I've said consistently the way out of this pandemic is the successful rollout of the Commonwealth's vaccine program and the establishment of an alternative quarantine facility, not just in Victoria but elsewhere around the country. That is our path out of this. The sooner we get vaccinated, the sooner that we can ease all of our restrictions. That is the path out of this pandemic. And as we've just heard from the COVID-19 commander, you know, we're delivering at our capacity. It is fantastic to see the levels both of testing and of vaccinations that are happening right now. We could do more, but you've got to have some long-term confidence in the supply of the vaccine. Now, the vaccine program has been delayed. That is a fact. We could do more. That is a fact. We would be in a very different world if we had large numbers of vaccinations across our country and alternative quarantine hubs. But we don't live in a world of what-ifs. We live in a world of reality. And the reality is the Commonwealth's vaccination program has been delayed. The reality is, outside of Howard Springs, there is no alternative quarantine facility outside of hotel quarantine. That's the reality, and that means you get breaches. You get this breach, this outbreak goes back to a hotel quarantine breach in South Australia. We need to have a 7-day lockdown based on the advice of our public health team because we don't have the levels of vaccinations around our state and our country. That is the reality.
Just on that 7-day lockdown, the last snap lockdown that we had over Valentine's Day, we got to 5 cases. Oh, sorry, the second.
And with the second lockdown, we had a goal of 5 cases a day and 5 weekly cases a day. We have a similar thing with
So it's all based on public health advice, and as we've heard from Professor Sutton in these forums a number of times, there's a number of issues that are taken into consideration in terms of the public health advice that is given. The number of cases, the type of cases, whether they're mystery cases, the number of exposure sites, the pace of transmission, all of those things are taken into account. Now, we are still early days. As Tim and Jerome have said, we are 3 days into a 7-day lockdown. This is a very, very serious matter. Today we're talking about a mystery case. Today we're talking about aged care. There is a lot of work to do. Our contact tracers are working at an unbelievable pace. We're getting testing numbers that are just outstanding, and I want to thank all Victorians, but it is still early days.
But what are those goals? Are they goals?
Well, this is something that is evaluated every hour of every day. We are meeting constantly, getting advice from public health in terms of how we're tracking, and Jerome goes to those details every single day, how we're tracking in trying to get ahead of this outbreak. But this is day 3 of 7. I do appreciate the questions. This is front of mind for all Victorians. The advice from public health team is that they require a 7-day circuit breaker lockdown to get ahead of this outbreak, and we are 3 days into that 7-day period of time. There's no threshold. We will get advice from public health when we can ease restrictions on this 7-day circuit breaker lockdown. But I go back to the advice we received just days ago from public health that we needed to go into this circuit breaker lockdown, because if we can't get ahead of this outbreak, then it becomes uncontrollable, and everyone knows what that means. That's why, you can't pick and choose the advice we receive from public health. You've got to act on the advice that we have. Now, we want to get out of this as quickly as possible, and that is why our contact tracers, we've got 2,400 people in our public health team doing wonderful, wonderful hard work getting in front of this outbreak. But we are still too early to talk about any easing of restrictions. This is a very, very serious outbreak.
Now that we have a list of those in our most vulnerable settings, would you like to see the lockdown change?
What I would like is what every Victorian would like, and that is the circuit breaker lockdown to work as it has done in the past, for our public health team to get in front of this outbreak, and then we can ease restrictions. That's the only thing that I am worried about.
Do you think it's working?
Yes, I do. I think our public health team are doing a brilliant job, from our contact tracers to our nurses, our pathology staff. Everyone is doing a brilliant job getting in front of this, but this is very, very serious. And as we've seen today, we have a mystery case. We're concerned about that. We're concerned about the serious situation in this aged care facility. We cannot ease our efforts, and that is why it's just so disappointing that we have a federal government that is picking and choosing when they support Victorians and Victorian businesses.
So if the kids don't come to it, are you going to have to step up to support them? Because there's going to be a lot of people trying to pay their rent, trying to buy groceries, trying to pay bills, who are going to have no income this week. That's going to happen. They don't care where the money comes from. It's, who's going to pay?
Well, this is why we've announced a $250 million package. This is bigger and broader than the package we announced back in February. We don't have JobKeeper, and that was one of the reasons why we broadened the eligibility for the business support for businesses of up to 3 million to now businesses up to 10 million. So small, medium-sized businesses and sole traders. We've made it broader, and we've made the individual grants larger, and it will go to things such as assisting businesses pay rent, assisting businesses paying the wages of their staff, or indeed replacing perishable goods by virtue of the fact that it's a 7-day lockdown.
So will businesses be required to keep paying their casual staff who might work 5 days? What happens there?
Well, Lundy, that's exactly why, I spoke to the Prime Minister, Tim spoke to the Federal Treasurer to strongly advocate that they can't leave the field, and that's exactly what they're doing. It was a no. Every discussion we had with the federal government was a no, and I just feel that is disgraceful.
But acting Premier, the blame game doesn't pay someone's rent or buy them groceries, so who will foot the bill for those payments?
Yeah,
if the federal government doesn't
you are absolutely right, and that's why we've got a $250 million package, bigger and broader than the package we provided to businesses in the February circuit breaker lockdown. We are doing our utmost to support Victorian businesses. I know that they're doing it hard. I know that this circuit breaker lockdown is devastating for them, and that's why we committed to have a support package. It's a big support package, the best that we can deliver. It goes to not only general businesses, hospitality, events organisers, but the fact that the federal government one day say they want to work hand in glove with the Victorian government in supporting Victorians, yet when we most need their support, the answer from the Prime Minister and the Treasurer is no. That is just, it is beyond disappointing, and it's why the Treasurer is so angry. Every Victorian business should be angry. We are doing our best. A $250 million support package. Given that JobKeeper is no longer around, I cannot understand why the federal government is not supporting Victorian businesses.
So what do you say to workers who can't pay bills? Where do they get the money from?
We've got emergency relief. I know people are doing this really, really hard. We've got emergency relief in terms of food and other emergency supports. We've got the $250 million package to businesses that will assist them in paying rent, paying wages, and replacing perishable items. But we know that more needs to be done, but in terms of wage subsidies, that is a federal government responsibility. For the Prime Minister and the Federal Treasurer to say no is a disgrace, and it should make every Victorian angry.
Premier, are you
Jerome answered this question directly. No, he did. Jerome answered this question directly. We do not have oversight over the federal government's responsibility in terms of private aged care. So those questions should go to them. In terms of state-run facilities, all residents have had the opportunity to get vaccinated, and around 85 to 90% of those residents have taken up that opportunity. Oh, look, Samaya, I don't think that's a fair question. We are unashamedly advocating to the federal government on alternative quarantine, on rolling out the vaccine as quickly and effectively as possible, and advocating to the federal government in terms of supporting businesses in their time of greatest need. It would be a fair question if we were doing nothing. So whilst we are advocating to the federal government for all of this support, we are delivering a business support package of $250 million. We have increased eligibility for vaccinations just recently to 40 to 49-year-olds at our state sites to make sure that we can do what we can to make sure that as many people as possible are being vaccinated. We put $15 million on the table for the Alternative Quarantine Hub to do the planning and the design work. So whilst the Commonwealth Government are thinking about what they're going to do, we're getting on with it, cracking on with doing the planning and the design so we can get an alternative quarantine facility built as quickly as possible. So the action has been taken. The advocacy has been put very, very firmly to the federal government. But what we get back from the Prime Minister and the Treasurer is they pick and choose when they want to help and support Victorians, and I don't think that's good enough.
Since this whole sort of started, do you have a ballpark figure on the amount of aid the state has paid in terms of business and individual support?
$13 billion. Just $13 billion. If you look at support in a broader sense of the word, and it includes counter-cyclical investment in the way that the economy operates, how we create jobs, that number is closer to $75 billion of extra support. Samaya, your question. Currently, we gave 16,774 business cost assistant grant payments of $2,000 and another 8,000 thereabouts to the Liquor Hospitality Venue Fund, some $3,000 payments, so about 25,000. So as a consequence of the Ombudsman's report, there were some 12,000 applications that the department is now going back over and looking to see whether we've properly and fully acquitted the Ombudsman's obligations. Look, you probably discerned through my subtle jabs that I'm a little bit angry about the Commonwealth Government's behaviour in respect of this. But I'm not in the business of spending my time blaming the federal government about every step along the way. Of course, to get the vaccine rollout done and done effectively, we are going to work as cooperatively as possible with the Commonwealth. Most notably, the greater identification of continuity of supply and the volume of supply coming through the state, the greater certainty we have, the greater capacity we have to roll out and to increase our vaccination program. And we want to help. I mean, we actually see this as being something that states have a greater capacity to support the Commonwealth in they're having difficulties identifying their supply lines. They're having difficulty being able to give us, therefore, the confidence. Remember, we're not far off second doses having to be applied to quite a number of people, as well as vaccinating the entire population. So getting that done is vitally important. Arguing with the Commonwealth is pretty much, well, I think a gratuity. But at the moment, you've asked a series of questions today about, well, what are working people going to do? And I think they are legitimate questions. All we can put in place is effectively subsistence support through our food bank arrangements, and that effort will continue. We've given about 8,000 two-week packages of food support out already, and we will look to see what more we can do. But the key for us is to get the Commonwealth to do this. Why? Putting aside who's responsible, apart from the obvious that the Commonwealth are responsible, they're responsible for welfare payments. They have an understanding about the income tax system, so they have a relationship with each individual and they can contact and deal with them quickly. That's why we're dealing with business. We have a payroll tax system. We know who they are. They've participated in business support fund contributions in the past. The Commonwealth have a relationship with the employees and they can get in contact with them quickly, and they have a network of welfare through Centrelink and through other payments that can be managed. But at the moment, they have a standard statement that says if it is a statewide lockdown, you have no access to Commonwealth support. And quite frankly, I think it's unfair, and I think it's very, very concerning that the welfare of the population has been compromised in this way at a time when we need to work together cooperatively to attend to the needs of the community as we fight this pandemic. So. I suppose I could ask the same question. We've put, as I say, close to $75 billion in increased effort by the state of Victoria, $14 billion in November, $49 billion rather in November, and another 26 in the last budget. Yes, we've done a lot too. If it's about sitting around talking about how much we've done in the past, we can compare the pair and argue about who's done the most. That will not count a jot for people in need. What they need to know is that governments of all persuasions are doing the heavy lifting. And we're not asking the Commonwealth to do something we're not prepared to do ourselves. So why is it that they've taken this view that they see a right to absolve themselves of responsibility? Every step along the way of the journey, we have seen far too often from the federal government a willingness to try and find somebody else to take responsibility for their job, whether it's vaccine rollout or whether it's quarantine, you name it. The Commonwealth have found a way to find somebody else to blame because they don't like taking responsibility. Well, that's fine, but when it translates into putting the welfare and well-being of this community at risk, well, we'll call it out. Sorry, you won for me or the acting Premier? James.
What's the latest on those negotiations?
So I don't have any update than the last time I was asked this question. We did have the progress in terms of the EOI went out to industry, as well as approval from the Commonwealth to access both of the sites in Mickleham and in Avalon. So we're doing that. We're doing that work as quickly as possible. I'm very hopeful. I know you've heard me say this a number of times. I'm hopeful of a positive outcome and a final green light from the federal government in terms of the construction of the facility, this much needed alternative quarantine facility, and the federal government funding the construction of what will be their facility on Commonwealth land. I just can't give you that today. But we're not waiting for that green light from the federal government. We've got access to the sites and we're doing the intense design and planning work, which will mean that we can get this constructed as quickly as possible. To be honest, I'll have to come back to you on that.
Acting Premier, is there any chance that State of Origin can go ahead with bans on June 9?
There are active discussions between public health, event organisers, the Minister for Sport and his Major Rents and his team. No final decision has been made, as I'm aware, but changes may well need to be made given the public health constraints around the COVID lockdown at this stage.
Having fans though in the stadium?
I'm not going to foreshadow what may or may not happen for events beyond the circuit breaker, but I understand that those discussions are happening right now.
Back on vaccines, the UK is 3% most vaccines. Would you like to see the Feds call for that to, I guess, speed up that process?
Yeah, it's an interesting question, and I understand that public health officials at a national level through AHPPC and ATAGI are looking at what that may look like. For example, you could have a situation where you prioritise first doses and then you have a longer period of time before a second dose. There's been no final advice from health officials on that question, but I understand it is being looked at.
You flagged that you want eligibility to be widened past that 40 to 49 age group. Do we have enough vaccine supply to get that in
Yeah, and that's the critical question. We want to widen eligibility as quickly as possible. We've got confidence in supply and capacity that we could expand to the 40 to 49-year-old age cohort. I would love to be here making an announcement that we're going to increase that eligibility even further. We want to do that as quickly as we can, but that absolutely comes down to our confidence and confirmation of supply so we can do just that. We've got the capacity to do more. I would love to increase eligibility, but it comes down to the confidence of supply from the Commonwealth to states and territories so we can make those decisions. We need confidence. At the moment, we've got confidence in the supply that we've got right now, and for the next period of time, to deliver around those 20,000 vaccinations per day. We would love to do more. We would love to increase the eligibility, but it is dependent on the confirmation of supply and the confidence of our GP networks, of our state sites, that we've got the necessary vaccinations so we can increase eligibility. I'm not aware. I'm not sure. So that is a matter for the Commonwealth, and it's a valid question, Samaya. I don't have the answer in front of me in terms of, or to mind, in terms of what they are actually delivering at the moment. Yeah, look, it's a good and understandable question. As I've said a couple of times, this was a most tragic outcome. Every parent's worst nightmare, losing a child while that child is on a school camp, having a great time. It's just the most tragic event, and my heart goes out to the family of that young boy, to the school community and the broader community. I had discussions with the Chief Health Officer. These are decisions of the public health team. There's a team within public health that look at possible exemptions. They are rightly and appropriately absolutely not decisions that ministers make, that myself as Acting Premier would make. It is based on the exemptions team within the public health unit. I'm happy to connect you to them as to what they look at when making those exemptions.
Are you aware of people being turned away from the
Today? No, I'm not aware. I'm not sure, Jerome, if you've got the latest in terms of how the max vaccination sites are operating today. So they're going well. I haven't heard those reports, and as we've said a number of times, I know whether it's testing or whether it's vaccination, I'm just so delighted that Victorians are coming forward, and it shows how seriously all Victorians are taking this outbreak, and we're seeing that in terms of the numbers of vaccinations and testing, and the calls to the call centre. I want to acknowledge and say to people that I appreciate that there may be some